On December 5, 2024, Brian Thompson, the CEO of UnitedHealthcare, was assassinated on the streets of New York City. Within days, a suspected perpetrator was arrested and charged with murder. The attack appears to be politically motivated, with the suspect being a critic of the health insurance industry and corporate America in general. While everyone is entitled to the presumption of innocence, the evidence against the arrested suspect appears to be pretty overwhelming. He is likely to spend the rest of his life in prison. If you spend any time on social media, you've likely seen a deluge of posts and comments criticizing UnitedHealthcare and the health insurance industry in general. The assassination of Mr. Thompson has sparked a broader debate about healthcare in America. Healthcare can be an emotionally charged topic, as people's ability to access high-quality medical care can literally be a life-or-death situation. The cost of health insurance seems to inflate every year as health insurance companies report record profits. When dealing with controversial issues like this, it's important to look at the facts as objectively as possible. In this video, we'll analyze the American healthcare system and why the health insurance industry is so controversial. The American healthcare system as we know it today was largely established in 2010 with the passage of the Affordable Care Act, colloquially referred to as Obamacare. Obamacare is a comprehensive healthcare law that in theory should afford all Americans with access to healthcare. Today, over 90% of Americans indeed have health insurance. As a result of Obamacare, all large employers are required to provide health insurance to their full-time employees. The majority of Americans receive coverage through their employer. So what happens when you retire? If you're over the age of 65 and have a long enough work history, you can qualify for Medicare, which is paid for by the government. The majority of Medicare members pay nothing. About 1/3 of people are either not employed, self-employed, or only work part-time, and thus do not receive health insurance through their employer. There are two options for these people. If your income is below a certain threshold, you can qualify for Medicaid, which is government-subsidized health insurance. You might have to pay for a nominal monthly fee, but the government foots the vast majority of the bill. About 22% of Americans qualify for Medicaid. Finally, about 6% of Americans get coverage from the individual market. As part of Obamacare, the government sets up a website called healthcare.gov. This is the so-called individual market. Private health insurance companies offer plans through healthcare.gov. Obamacare provides a sliding scale of subsidization based on your income, so in theory, everybody should be able to afford health insurance. Even when the government is paying for or subsidizing health insurance, the insurance is usually administered by a private health insurance company. Even if you're on Medicare, the government often doesn't pay for your medical treatment directly. Instead, the government pays private insurance companies to provide coverage to Medicare members. This is called Medicare Advantage. The U.S. healthcare system has long been criticized for its apparent wastefulness. The U.S. spends over 16% of its GDP on healthcare, which is more than any other country. Total healthcare spending in the US is almost $13,000 per person per year. This is almost double the average of other advanced economies. Despite spending so much more money, the US has worse health outcomes. Among the top 13 advanced economies, the US ranks worst in life expectancy, infant mortality, unmanaged diabetes, and safety during childbirth. There are many reasons contributing to the high cost of healthcare. The United States has the highest rate of obesity of any major country in the world. Over 40% of adults in the United States are obese. About 70% are either overweight or obese. This has significant implications for healthcare costs. The United States also has the highest rate of drug overdoses of any major country. While demographic factors certainly play a role, they do not completely explain why healthcare in America is so expensive. The US spends significantly more on administrative functions than any other country. Hospitals and physicians' practices need to be approved by the insurance companies to be within their coverage network. When you receive medical treatment, the care provider needs to file a claim with the insurance company. The insurance companies require significant paperwork to verify that the treatment was medically necessary and within the scope of the coverage. Pharmacies also have extremely complicated relationships with the health insurance companies, which adds another administrative burden. Now let's look at how UnitedHealthcare fits into the picture. UnitedHealthcare is the largest health insurance company in the United States, with approximately 30 million members. UnitedHealthcare is a subsidiary of the UnitedHealth Group. Brian Thompson was the CEO of UnitedHealthcare. The CEO of UnitedHealth Group is a different man named Andrew Whitty. The UnitedHealth Group has two main subsidiaries, UnitedHealthcare and Optum. UnitedHealthcare provides health insurance. Optum provides healthcare services, pharmacy-related services, as well as technology and consulting services for the healthcare industry. In 2023, UnitedHealthcare generated $281 billion of revenue, primarily consisting of insurance premiums. Optum generated $226 billion of revenue. The majority of Optum's revenue comes from UnitedHealthcare. UnitedHealthcare pays Optum to provide medical services to its members. Optum also provides healthcare services to third parties. The intercompany revenue is eliminated upon consolidation. In 2023, the UnitedHealth Group generated $371 billion of revenue and an operating profit of $32 billion, making it one of the largest and most profitable companies in the United States. UnitedHealth provides health insurance to individuals via healthcare.gov. They also provide health insurance under Medicare Advantage, where the government pays them for each elderly patient they insure. And finally, they offer health insurance plans to employers. Large employers sometimes self-insure the healthcare costs of their employees. They pay UnitedHealth to handle all the administrative aspects and provide access to its network of physicians and other medical services. But the cost of the healthcare is not paid by UnitedHealth, it is paid by the employer. If you need to see a doctor or get some prescription drugs, you go to a hospital or pharmacy within UnitedHealthcare's network. UnitedHealth sends the medical bills directly to your employer. UnitedHealth does not collect premiums for the employer. The employer just pays a fixed fee to UnitedHealth for its administrative services. Now let's look at the second half of the business, Optum. The UnitedHealth Group created Optum in 2011 and built it up throughout the years through numerous acquisitions. Today, Optum has three segments: Optum Rx, Optum Health, and Optum Insight. Optum Rx is a so-called Pharmacy Benefit Manager, or PBM. The PBM is responsible for creating the formulary. A formulary is essentially a list of prescription drugs that a health insurance plan covers, as well as the copay the patient has to pay out of pocket. The PBM negotiates with the drug manufacturers about the prices they'll pay for various drugs. The PBM also determines which pharmacies are within the network and negotiates dispensing fees the pharmacies get paid to dispense each drug. By owning its own PBM, UnitedHealth has greater control over costs. Due to UnitedHealth's massive size, they have significant negotiating leverage over the drug manufacturers and pharmacies. The next part of Optum is Optum Health. Over the years, Optum Health has established or acquired numerous health practices across the country. Optum Health employs over 90,000 physicians who work at its practices. UnitedHealth can send its members to receive healthcare at Optum Health clinics. This vertical integration gives the UnitedHealth Group more control over the value chain. In theory, this should make the system more efficient. For example, it's easier for UnitedHealth to keep track of a patient's medical records if he or she is being treated by Optum. The final segment of Optum is Optum Insight. Optum Insight provides technology tools and consulting services both to Optum-owned clinics and third-party clinics. Many of the clinics that use Optum Insight services are also within UnitedHealth's network and bill UnitedHealth for services they provide to its members. You can see how everything is interconnected. Optum Insights has significant influence over how clinics operate. This may have implications for how these clinics bill UnitedHealth for medical procedures they perform. The UnitedHealth Group's strategy of vertical integration has been extremely successful. As you can see, their revenue and operating profit have increased steadily year after year. Their market capitalization is almost $500 billion, making them the 15th most valuable company in America, worth more than MasterCard, ExxonMobil, or Netflix. This has led many to wonder whether or not UnitedHealth is making excessive profits at the expense of its members. This graphic has gone viral on social media. It shows that UnitedHealthcare denies almost 1/3 of medical claims. This is a far higher denial rate than any other insurance company. For any insurance company, there can be a conflict of interest. The more claims the insurer pays out, the less profit it makes, so there can be an incentive to deny as many claims as possible. Obamacare tried to solve this problem by setting minimum medical loss ratios. Insurance companies are required to maintain a medical loss ratio of more than 80%. If in a given year their medical loss ratio is below 80%, they have to refund part of their members' premiums. The medical loss ratio is the money spent on medical claims divided by the premiums collected. So at least 80% of premiums have to go to actually paying for healthcare. The purpose of this regulation is to prevent insurance companies from earning excessive profits. In the case of UnitedHealth, they are indeed compliant with this regulation. Their medical loss ratio is typically in the 81 to 83% range, just above the minimum threshold. It was slightly lower than 80% in 2020 as many elective procedures were postponed during the pandemic. But other than that, they are compliant. In theory, insurance companies like United should not be able to earn excessive profits, but they can still have an incentive to deny claims. If they deny a lot of claims, they can reduce the premiums they charge. Offering lower premiums may help them gain market share. A significant portion of United's business is with Medicare Advantage. The government pays a fixed amount of money for each patient depending on the age and pre-existing conditions. UnitedHealthcare is incentivized to get the medical loss ratio as close to 80% as possible. This may involve denying claims. At an investor conference in 2023, UnitedHealth Group CEO Andrew Whitty addressed this very issue.
We are focused on not simply wringing our hands, but dealing with it. A good example this year, the rate notice on Medicare Advantage earlier this year, significant change in the funding outlook for the future from Medicare Advantage. That rate notice has a material impact in terms of revenues associated with our Medicare Advantage portfolio, and as you can see, that ripples through the metrics of the organization. As revenues, essentially a price cut for Medicare Advantage occurs, you see that pattern flow through the business. And yet here we are today standing up and saying, despite that change, despite that impact, we are committed to the kind of earnings growth rate over the next 12 months that you would expect from us, even if there hadn't been a rate notice cut. And the reason for that is we spent the last 6 months reconfiguring our plans for the next year and 2 and 3 and 5 years in response to the change in circumstance. We focused on how we can protect members and their benefits. We focused on how we can take more cost and efficiency into our organization. And we focused on how we can double down on eliminating waste and unnecessary care in the health system more generally. We've used that adverse event in terms of the rate notice change as a stimulus, as a catalyst, as a way to make us rethink and redouble our energies around the things we've always believed. That we'll put our members first, that we will strive to be the most efficient healthcare delivery organization in the country, and that we will focus on delivering true value-based care, meaning that the care you need is great, but you don't get care you don't need. Meaning that if you do a great job delivering care, we will pay what you deserve, but we will not pay where the work that's delivered is not necessary or is not high quality.
In 2023, the government announced a modest cut to Medicare Advantage rates, scheduled to take effect in 2025. On average, insurance companies will receive 1% less money per Medicare Advantage patient they cover. While a 1% cut doesn't sound like a lot, usually these rates increase with inflation. So it's very unusual to have a nominal price cut. Health insurance companies are very aggressive in reporting, and in some cases exaggerating the pre-existing conditions of their beneficiaries to get larger payments from the government. According to some studies, this has resulted in the insurance companies making excessive profits. Due to the aging population, the Medicare Trust is on track to go broke by 2036. It is thus vital to get Medicare costs under control. That's why the government implemented this 1% rate cut to Medicare Advantage. Despite this unfavorable revenue variance, UnitedHealth claims its profits will grow at the same rate nonetheless. Obviously, if your revenue is decreasing, the only way to increase your profits is by reducing costs. UnitedHealth achieves these cost cuts by reducing coverage of medical procedures that it deems to be unnecessary. Of course, there can be a disagreement over which medical treatments should be considered necessary. UnitedHealth has been the subject of a number of controversies regarding its denial of claims. Last year, the nonprofit newsroom ProPublica conducted an investigation into one particular case. One patient had a severe and chronic condition requiring extensive medical care. His treatment incurred medical bills of nearly $2 million per year, mostly consisting of extremely specialized and expensive medication. UnitedHealthcare staff reviewed the case. They determined that his treatment was not medically necessary. United had one of its doctors review the case. The doctor concluded that the treatment was indeed necessary, and a cessation of the current treatment would put the patient's health at risk. United didn't like this assessment, so they got a different doctor who said the treatment in question was not necessary. The new doctor recommended an alternative treatment that was less effective but also much cheaper. In this case, the patient filed a lawsuit against United, and they ultimately paid for his expensive treatment. But this is unusual. Less than 1% of denied health insurance claims are ever appealed. Most people don't have the resources or mental energy to engage in complex litigation, especially when they're already sick, so they just cope with whatever decision the insurance company makes. This was an extreme case, with a specialized treatment costing $2 million per year. But the denial of claims does appear to be a systemic issue at United and many other large insurers. In an attempt to increase efficiency, UnitedHealth has implemented AI-based software to help manage the claims process. The AI looks at various factors to determine if the requested care is medically necessary. In October of this year, the Senate Committee on Investigations published a report analyzing the practices of health insurance companies, particularly with regards to post-acute care for Medicare Advantage patients. Following acute care such as a surgery, many patients require weeks, if not months, in a skilled nursing facility. Extended stays at these facilities can be very expensive. After implementing AI-based systems to review these claims, the denial rate for post-acute care surged from 1% in 2019 to more than 12% in 2022. Having a heartless AI system decide what care you get seems like something out of a dystopian sci-fi film. To be clear, in any insurance system, some claims have to be denied. Sometimes, the requested medical treatment is indeed unnecessary. The fact that some claims are denied does not in and of itself mean the system is corrupt. Even in countries like Canada and the UK, with single-payer healthcare systems, not everybody gets the care that they want. Every healthcare system has to prioritize how they allocate their limited resources. Let's say you're terminally ill, and there's a specialized treatment that costs hundreds of thousands of dollars. It may extend your life for a few months, of which you'll be in extreme pain. The hospital administrators may decide that it's not worth it, and you should receive hospice care instead. In countries with large single-payer healthcare systems, these types of decisions are made by government employees who work based on guidelines set by the government. In the United States, we have a much more complicated system. Despite the fact that the government pays for a significant portion of all healthcare spending, most of the administrative responsibilities are outsourced to for-profit companies. The primary goal of insurance companies is to maintain their profits. We saw this when the UnitedHealth Group CEO bragged about their ability to maintain profit growth despite cuts to Medicare funding. When you have for-profit companies effectively making life or death decisions for their members, this will inevitably result in controversy. Alright guys, that wraps it up for this video. What do you think about health insurance? Let us know in the comments section below. As always, thank you so much for watching and we'll see you in the next one. Wall Street Millennial, signing out.